Hello, my name is Gabriella Stern. I'm the Director of Communications at the World Health Organization. We're here in Geneva at headquarters, and I'm really pleased to have my colleague Lindsay Lee here. She is an expert here at the World Health Organization on people with disability and related issues. So, in a few moments, we're going to go to your questions. I thought I would kick this off by asking Lindsay a few questions to start out with. So Lindsay, welcome.
Thank
I'm really
you.
glad that you're here because there are a few issues as important as how people with disability can cope and live and preserve their physical and mental health during this COVID-19 outbreak. So perhaps you can start by telling our audiences why are additional considerations needed for people with disability during the coronavirus outbreak?
Yep, so it's a really important thing to consider. So we all know the whole world is impacted by COVID-19 at the moment, but it's important to keep in mind that this impact is felt by different groups in different ways. So people with disability themselves being a very diverse group, experience, I would categorize two categories of additional risk. So the first category being an increased risk of contracting COVID-19, and this is for various reasons. So firstly, some people with disability might experience barriers to implementing the basic hygiene measures that WHO and other institutions are recommending. So for example, perhaps they have a harder time having access to a sink or to rubbing their hands together, or perhaps they need to touch their face more often than other groups. They also might have more difficulty enacting social distancing, which we're all talking about so much, because they perhaps have to be in close contact with other people who support them in various ways. So that's one category of risk, a risk of increased risk of contracting COVID-19. There's also, for some people, an increased risk, if they were to contract COVID-19, of developing a severe case. So this might be because COVID-19, we have seen in evidence, can exacerbate existing health conditions, particularly those related to immune response or our respiratory function. And also we have to keep in mind that a lot of people with disabilities experience barriers in many aspects of the environment, but also particularly in the healthcare system. So existing barriers in healthcare unfortunately still exist and need to be mitigated during this outbreak.
Yeah. I'm just going to say a word about captioning. We are working on captioning for this broadcast, so it should be coming soon. So Lindsay, the points you make are really interesting, and I guess the next logical question is, if you're a person with disability, how do you then take the measures needed to protect yourself under these various circumstances where either you might not be able to fully implement the self-protection, hygiene, and other measures, or you end up in a facility that isn't prepared for you?
Mm-hmm. Mm-hmm. Yeah, so I'm going to categorize what people with disability can do to mitigate these risks in three general categories. So the first one is to enact as best you can the basic protection measures that WHO is recommending. So that is frequent hand washing, that's not touching your face, that's maintaining social distance from people who are symptomatic, and especially if you yourself are symptomatic. But for each of these measures, think through them very concretely and think, okay, am I able to wash my hands frequently? If not, identify what are the specific barriers in place for me to be able to do that, and then identify, okay, what are solutions that I can take to mitigate or to overcome these barriers. And thinking through these barriers in a very concrete and specific way can help you identify these types of solutions. Unfortunately, it's a fact of life that a lot of people with disabilities every day of their lives have to come up with adaptations. This is no different, and it's entirely possible for people with experiencing different barriers to come up with solutions to overcome these barriers. So that's the first thing. Do all you can to enact these basic hygiene measures. The second is make a plan with your support network. So think through, okay, if I were to contract COVID-19, what do I need to have in place? What supplies, that could be medication or assistive products, do I need to make sure I have available? Who is there in my support network that I can call upon? But also, if people in your support network were to contract COVID-19, who are people who can fill in the gap that would come to pass if perhaps they provide some sort of support or care for you? Who else can provide that care? So that's one thing, so making a plan. The third thing, communicate. So make sure you are constantly communicating with everyone in your support network. It could be in person, but as a lot of us are sitting at home these days, via text message, via video chat. Make sure that everyone in your support network knows what you need, knows your health status, how you're doing, and also that the people in your network know each other as well, so that they can speak to each other in case they need to fill in for a particular need that you have.
And I suppose they had better know how they can both protect themselves and protect you. So they have to follow the public health measures that we and others are recommending, so that when and if they come to see you, they're not bringing the virus in.
Exactly.
Or if you as a person with disability have the virus, that you're not giving it to them. So it's very complex, isn't it?
And we all know everyone in our world right now has a responsibility to be doing all they can to follow these basic measures, no matter what your status is. So if you have someone coming to visit your home, ask them, say, hey, please wash your hands, first thing when they walk into the door. It's a time where we need to be willing to be a bit aggressive like that with people, especially if you're at a higher risk.
Yeah, and I would imagine that there are some people in caregiving positions who are reluctant to leave their houses and go and work with one of their clients. And so that actually is all the more reason why people need backup plans and backup plans to backup plans, perhaps, right?
Exactly.
So it's really complicated. On the other hand, it sounds very, very doable.
Yeah. It's certainly, might not be easy, but it's important. And actually, once you have a plan in place, and it can help alleviate maybe some anxieties or some fears that you might have. It's knowing the facts and coming up with a plan is what's going to help people feel safe in this time.
Do you have thoughts on what both governments and disability providers can and should be doing right now?
Yeah, absolutely. So governments have a lot of responsibility during this crisis overall, as we know. And firstly, before I talk about this outbreak in particular, I want to say that governments have a responsibility in general of making sure that their societies are accessible to people with disabilities. That's an ongoing work that governments are doing more and more to make their societies more inclusive, especially within healthcare settings. So that's the first thing that governments should be doing, is always making sure that the services that are being provided, especially in this time, healthcare services, are being provided in an accessible way. And we have guidance on that. WHO has guidance on that we could talk about in more detail. But specifically during this crisis, governments need to be making sure that they're providing public health information in ways and means that are accessible to different people. So this means providing information in using different communication modes. So if you're putting out a text document on a website, you need to make sure that that document has accessibility features. If you are putting out a video, you need to make sure that it is captioned, which we are trying to do with this video at the moment, and I'm being told that the captions are working now. If you're putting out photos and imagery first of all, the images need to not be stigmatizing to people with disabilities, but they also need to be captioned and have some sort of description to them. And also if you have information lines, hotlines that people can call to get more information, making sure that those hotlines are provided in different means. So maybe you have one that's audio, maybe you have a video line as well, maybe you have an email or text line that people can access. So that's really important. So other things that governments can do, they can provide targeted measures to people with disability and their families. So this could be fiscal things such as making sure that people with disabilities and their families have the resources that they need to cope during this time, whether that's, and supplies like food, water, any medication or personal protective equipment. And they can also ensure that disability service providers, so such as paid caregivers, are also given priority access to protective equipment like masks, mask, gloves, hand sanitizers. Maybe I'll stop there for the moment.
And do you see a difference between a person with disability who might be in a high income setting versus in a low income setting? I think about this a lot as the coronavirus spreads to lower income countries where people live, they have less privileged surroundings, they might live many people to a room, they might live in remote rural areas, the challenges there might be very different from in a place like Geneva where we are, or Singapore or New York.
Yeah, exactly. So it's important to note that people with disability are everywhere. And WHO numbers show that actually most people with disability in the world live in low and middle income countries. So it's an issue that's extremely prevalent in these areas. And it's also important to note that the right to healthcare and the rights of people with disabilities are not subject to a particular income level of the country, right? So you have the same rights in low and middle income countries as you do in high income countries. But like you say, the types of adaptations that people might make to participate fully in the society might be different, or maybe perhaps in high income countries, people might have more access to paid care, where in low and middle income countries, there's more of a community care that's provided. So you really just have to think through in your own setting, what are the services and the support I have available right now? What can I do based on what I have to ensure that I'm protecting myself in this outbreak? And you can do that no matter where you are.
Yeah. I'm just wondering if we have questions from the audience yet, and I'm just going to check, and if we do, I will take them, and if not, I have a million questions for you.
Great.
Okay, so here's one. So how can communities support people with disabilities in this outbreak, both in terms of things like you said, checking in, but also checking in physically or remotely, or advocacy, or any kinds of things, errands?
Yeah. So actually, you've already begun to answer my question. So, but I would say even before all of that, the number one thing that you can do to protect vulnerable people, whether that's people with disability or other groups in your community, is to make sure you're following the basic protective measures. So make sure you're washing your hands, you're not touching your face. If you're sick especially, you're staying at home, you're maintaining social distance. Doing all of those things is already protecting people who are high risk, and yourself, obviously. But another thing you can do, obviously, if you know of people in your community who you suspect might have some sort of additional risk, check on them, like you said. So send them a text, see how they're doing, ask them if there's anything you can do for them. Even something like that, even if they don't take you up on that help, just that reaching out is going to help assuage any anxiety that might be there, and that person might then know, okay, here's another person in my life that I can call on should I need help. But other things that you can do if you are in a community and you're maybe a business owner or you're the manager of some sort of workplace, make sure you're following WHO guidance about what to do to prepare your workplace for the COVID-19 outbreak. Or if you're for instance, a shop owner and you're providing goods and services to the community, you could think about how you can target those services towards people with disability in your community. One good example of this that we have seen in some countries is some stores have decided to have designated opening hours just for older people or people with disability. Because getting in, I think we've seen on the news some of these this chaos that's come in some of these stores. Getting into that fray of people trying to grab food is not feasible for people who, for some people who might have disabilities. So that's one thing you can consider.
That's a great idea.
Yeah,
that's a really great idea.
Yeah, it's a great thing that we're seeing.
Yeah. If you want to ask questions, just a reminder to use on Twitter, use #AskWHO. And on Facebook and LinkedIn, just leave comments for us. So when you think about, you're a foremost expert in this subject, and when you're at home at night, what keeps you up at night most right now regarding people with disability, the COVID outbreak, and the evolving nature of this outbreak?
Yeah, it's a great question. I try and, I think all of us are trying to stay positive about things, right? And it's, it's important to think of the solutions and not just the things that are maybe scary to us. But yeah, I think what worries me perhaps more than anything is just the existing barriers that people with disabilities face. And and I can speak for this for myself personally. Accessing healthcare for a lot of people, even in high-income settings, is already in many cases extremely difficult for different reasons. It could be physical barriers. For me, if there's stairs, I can't go upstairs. It could be political barriers, like actual legal laws that discriminate against people with disabilities. It could be attitudinal barriers, existing stigma and discriminatory attitudes against people with disabilities. And these things, if governments, if communities aren't careful, can be exacerbated in crisis situations. And it's those sorts of things that worry me the most. But again, if the whole community is willing to do its part, these sorts of risks can certainly be mitigated.
So we have another question. What about persons with disability who require continuous home care or physiotherapy? Good question.
Yeah. So it's a really good question, and it goes back to what we were saying before about sometimes there's a difficulty in maintaining this social distancing. But it's, and our Director General and our Executive Director for the Emergencies Program have talked about this before in the press briefings, that social distancing is a strategy when you are, it's a strategy most suited for when you don't know who's infected, right? When you don't know the status of people. So if you're not able to maintain this social distancing for whatever reasons, you can still stay safe as long as you are aware of your status and the status of people around you. So that is probably what would be most important, is just making sure that people who are having to be close to others are continually, again, following basic WHO protective measures, but also keeping track of their symptoms. And if you begin to experience even mild symptoms, you immediately stop contact and tell people around you that you're experiencing the symptoms, so then they can take action. But then if, for example, a person with a disability becomes infected with COVID-19 and they still require, as they generally probably would, require the sort of routine care that they obtain in their everyday lives, there's things that you can do to prevent the infection between the infected person and the person who's giving some sort of care. For instance, you could put a mask on the person who's infected, making sure that you're keeping surfaces disinfected. So there's definitely things that you can do to prevent infection, even if you still have to stay close to each other for whatever reason.
Kathy from Twitter says that she's trying to do as much as she can for her communities by providing them with vetted information and the guidelines. But she wants to do more, which is great. Is there anything that bedbound people with disability can do to aid the international efforts more directly?
That's a really good question. So I think the first thing that's coming to mind for me is sharing, and what she's already saying, making sure that you're sharing vetted, true information. The whole world right now is operating on information, and that's, to me, that what comes to mind is the most important thing that you can do is helping to bust myths, or if you see friends and family sharing things that aren't true or sharing guidance that's false, making sure that you're stopping that from being shared. Other things that you can do, you can connect with local organizations. So there's tons and tons of organizations of people with disabilities all over the world that are already organizing themselves to advocate for the people in their communities, to governments, and to other official actors. So you can get in touch with local communities and you can become engaged in the advocacy that they're doing as well.
I think we on our platforms at WHO would be interested in things that people with disability are doing to help other people through this. And people with disability can help other people. Everybody can help one another. But if you want to send us stories on our social accounts of cool things that you've seen other people do to help each other, or things you're doing, please do. And it doesn't have to just be today. It can be in coming days and weeks. We would really like that.
Yeah, absolutely.
It occurs to me that if you are stuck at home, whether you're a person with disability or not, you could write a letter to somebody or call an elderly person, or there are many things you can do.
You can check up on your community members. If you need to talk to government officials, you can send messages to government officials asking that they enact particular policies. So there's lots that you can do, especially these days with all the technology that we have at our disposal.
For sure. I was interested in something that you said a few moments ago about legal barriers. What did you mean by that?
Well, I think so the first thing that I'll mention is there's a really landmark UN treaty called the UN Convention on the Rights of Persons with Disabilities that most countries in the world have ratified. And through this treaty, it's really the international legal framework for assuring the rights of people with disabilities all over the world. But still we're seeing that at the national level, in some locations, the policies might not be completely up to date with international standards regarding access to healthcare, but also information and to public space and these sorts of things.
So we have a question that we touched on earlier, and so I don't know if there's something we can elaborate, but the question is, what can governments do to support and protect people with disabilities during COVID-19? You talked about things like making sure the access laws and legislation are enforced, I guess locally and at the national level. Sending out accurate communications? Yeah,
accurate communications, but also accessible communications, right? So providing different means of communications that can be accessed by people with different types of needs. So that is really key in this time when we all very rapidly need access to accurate information very quickly in ways that are clear and that we can understand.
Yes. Not just multilingual, but multi-access.
Multi-mode, I would even say.
Multi-mode. And that's complicated, but it's eminently doable. One just has to do it.
One just becomes easy after you do it,
So it really comes back to the financial point you made earlier, which is the financial resources need to be released so that all of us collectively can hire the people or the services or whatever to create the content or create the help that's needed. So that's really important. We have a question from someone who says, my home carers come in 4 times a day to help with my personal care. Should they wear face masks?
It's a very good question.
Thanks for asking that.
So the WHO guidance at this point is that masks really only need to be worn if you yourself are symptomatic. So if you're infected and you're symptomatic, then you should wear a mask. Or if also, again, you are symptomatic and they are caring for you. So we're really not.
Shouldn't the health worker wear a mask too, or not?
I think it's only if you're.
Right, if you are, they should.
Yes. Yeah, one of you should.
One of you should.
Yeah. And I would say, look on the WHO website for the most specific information about masks. But in general, that's the principle: is if someone is infected, then either the infected person or the person providing care needs to be wearing some sort of mask.
Yeah, and we want health workers to protect themselves because they're precious resources.
Exactly.
We need them to stay healthy and strong so they can continue to care for people throughout the duration of the outbreak. And then certainly as the client or the patient, if you are infected with COVID and symptomatic, or even not symptomatic, I think that there are, and we can share the guidance on our social accounts, but there's a period of time in which you may be shedding the virus, as they put it. So what we'll do is we'll put really super clear guidance on our channels so that all of you have that info.
Can I make one more point on this? Is another thing that governments need to do, and in collaboration with these disability service providers that might be providing care, is making sure that people who are giving home health care do have priority access to masks if they need them, because that might be, it might not be a group of workers that's on the top of the mind of different governments. They're thinking of, doctors, nurses, but people who are providing home health care also need to be given access to personal protective equipment should it become necessary for them.
Yeah, WHO and our colleagues are really working hard to make sure not only that there's adequate production of these really important personal protective equipment items like masks and gowns and goggles and such. Not only that production is maintained and accelerated, but that it's delivered, sent, provided to those who are most in need, starting with health workers for the reasons that I mentioned. We have another question. What measures can you recommend for people using manual wheelchairs? Should they be disinfected?
Yes, very good question. And yes, they should regularly, especially if you are going outside, and your wheels are having contact with public space, especially then. And most importantly, the areas that are being handled the most. So that might be if someone is pushing you, the handlebars on the back, but then also the wheels, they should be disinfected regularly. So all high-touch surfaces in your household should be disinfected regularly. And for people with disability, this might include assistive products like manual wheelchairs, could be canes, walkers, white canes, or other materials that you touch often.
Yeah, and a colleague of mine even says, if you have a keypad on your door, I think the advice on that is just wash your hands properly and regularly.
Yeah. That's the number one thing, washing your hands regularly. Yeah. And for me also, electric wheelchairs, joysticks, also make sure you're disinfecting your joysticks as well.
Good question, thank you for that. Question here, what reasonable measures and precautions would you expect a shared house to do to support disabled people?
Yeah, so again, this goes back to what we were talking about earlier about having a plan. So it's important that all members of this household and the extended support network communicate with each other and talk through the steps that would be necessary to plan for the potential of anyone in the house becoming infected. So this, again, going back to our basic protective measures, making sure everyone's washing their hands very frequently, not touching their faces, disinfecting high frequency touch surfaces. But if you have the space in your household, it could be good to think of, okay, if someone were to become infected, where could be a space that we could essentially isolate the infected person, where there could be minimal contact with the other members of the household. That would be an important thing to think through as well.
We have a question here another mask question. So it's when to wear a mask, if you're healthy or if you're not healthy, if you're coughing or sneezing. And while we were talking just now, one of our expert colleagues, one of our mask experts texted, so I'm going to read what they said. If you're healthy, you only need to wear a mask if you're taking care of a person with suspected coronavirus infection.
Yeah.
If you are coughing or sneezing, wear a mask. Those who take care of sick with COVID, including health workers. Yeah, so I think that is pretty clear. So if you're healthy, wear a mask if you're taking care of a person with suspected COVID infection. If you're coughing or sneezing, good idea to wear a mask.
Yeah. It's also, if you're wearing a mask and you're healthy, it could end up, if you're not disposing of it properly, if you're not wearing it properly, it could end up being more of a source of infection than it actually helps. So it's important to follow this guidance and not really, have things on your face when you don't need to have them on your face.
I've seen experts say that actually improper use of a mask sometimes actually prompts a person to touch their face more.
Yeah.
So we'll put guidance on our channels and sites on this. And I think it's also important not to overemphasize the mask.
Yeah.
There's a comprehensive set of things one should do. The physical distancing like us, the hand hygiene, and many other things like that.
Yeah.
Before we wrap up, and we have to wrap up soon, could you say something about the mental health challenges for a person with disability during COVID? I think that's important to discuss.
Yeah. So in general, these are trying times for everyone, I'll say, and it's very stressful and can cause a lot of anxiety to be hearing constantly in the news, through all your networks, all your social media, everything about COVID-19 all the time. Yeah. And so this is difficult for everyone, but it could especially exacerbate existing mental health issues that some people with disability might experience. Of course, not all people with disability are very, very heterogeneous group and extremely diverse. So, but in general, I think the best thing that people can do, like I was saying in the beginning, is make sure you have the facts, know what's true. You can get the facts from WHO, from our WHO resources. And making sure that you have a plan for what could happen. So, making sure that you have figured out how you are going to enact these basic hygiene measures, especially if there's particular barriers to enacting these measures for you. Making sure that you have had, you've thought through all of the resources in your area, especially people in your support network that you can call upon should you need some kind of support, and making sure that you've communicated with all of them about your needs and that they've communicated with each other. You could even write things down, right? For me, I'm a person who loves a list. I love writing things down. So if you have all of this stuff written down, knowing that you have a plan in place can really help assuage these anxieties. And if you're doing that, if you have a plan in place, you're doing as well as you can, right? And you should feel good about that. And just because you might be someone who is at higher risk for contracting COVID-19, or for if you were to become infected, of developing a severe case, that doesn't mean you should give up, right? I mean, no one is doomed to this virus. There's things that all of us are doing to protect ourselves, and if you're if you're doing that, if you're taking all the necessary precautions, you're good to go, and you should take some pride in that and feel good about that.
Well, thank you so much for doing this today, Lindsay.
Yeah, thank you, thank you.
And thank you to a colleague of mine sent me the longest list of countries, people from countries who have tuned in. So thank you for everyone everywhere. We really appreciate it. We're here for you. Reach out to our various resources online, and we will be doing more lives like this coming up, so we'll see you soon. Thank you again.
Thank you. Thanks.